Should I mute myself? Should I? Mute my audio. Okay. Good afternoon, everyone, and thank you and welcome to Get Connected. We are so proud to be partnering with the Alliance for Business Leadership to present part 2 of what is a very timely discussion on allyship, featuring white male allies and leaders that I like to affectionately call white men who can jump. If you missed part 1, then don't be fearful. We actually have someone on our staff who will link the video in the chat and you could see our first one. I want to say that, first of all, this is possible, this event, to be free because of the sponsors that we have and the partners. And I want to especially give a shout out to Peter Slavin, who is one of our honorees from 2014. And Mass General was a founding partner of Get Connected. They were an early adopter 12 years ago. So Peter has been at this for a very long time. You know, America is facing what I call a twin-demic. It is coronavirus and racism. And Black America, when you think about it, is at the bottom of every disparity. It's almost as if it's a race to the bottom when you look at economics, at housing, at education, healthcare, just to name a few. And the time has come, I believe, for all of us to really understand that we must address this issue that has gone unaddressed for far too long. So this series is meant to look at allies across gender, across ethnicities, religions, and experiences. If you remember, as I mentioned earlier, I honored 12 white male leaders in 2014, 6 years ago. And these were white male allies who were moving the needle on diversity, equity, and inclusion in Boston. And while at the time it might have seemed controversial, today white males are at the epicenter of changing and also ensuring that people of color are at the table and are helping to dismantle structural and systemic racism. Like many of you who are on this call, I believe that white males have an important and significant role to play because they sit in the seats of power and influence. And that is why we have these men here today to talk about how the work they are doing within their own organizations is helping to dismantle racism. So a quick rundown of the schedule. I'm going to introduce the speakers and then we'll head right into the chat. So first up is I'm going with the oldest and youngest at heart, Professor Barry Bluestone, Professor Emeritus of Northeastern University, and a GK 2014 White Man Who Can Jump honoree. The youngest is Senator Nick Collins, who is a Massachusetts state senator, and he represents South Boston and Dorchester, and is an up and coming white man who can jump. And Sean Curran, who is the CEO of Waterville Consulting, a dear friend and another emerging white guy who can jump. Steve Grossman, many of us know Steve because he was the former state treasurer and he is a GK honoree from 2014 as a white man who can jump. And he's now the CEO of ICIC, Initiative for a Competitive Inner City. And last but by no means least, Peter Slavin, who is also a dear friend. And to be fully transparent, I am a former trustee, now an honorary trustee of Mass General Hospital. And I like to call it man's greatest hospital and the #1 hospital in the country, if not the world, and a 2014 honoree. Thank you all again for being here. And Peter, while you were the last, I'm going to make you the first person to ask this question too. You are the president of the single most prestigious hospital in the country. And like a forensic MRI, COVID-19 has revealed the health disparities that exist in our country, and in particular within the Black and Brown communities, with the Black community being totally at the bottom. I would like to ask you, how is Mass General addressing these issues? And as a leader in this field, what advice would you offer others in the healthcare field and in hospitals to really begin to chip away at this problem of the health disparities?
Mm-hmm. Thank you, Colette, for those very kind words about me and about the hospital. But we feel like we've just scratched the surface on these issues and have so much more to accomplish and are so much more motivated by what we've tragically witnessed over the last 6 or 7 months. At Mass General, at baseline, about 15% of our inpatients are Spanish speaking, and we realized very quickly during the course of the pandemic that about half of our COVID-19 patients were Spanish speaking, and that many of them were coming from Chelsea, East Boston, Revere, communities that rely on Mass General for primary and secondary care. So we could see from our intensive care unit and could connect the dots from the ICUs all the way back into the communities, into crowded housing projects, essential workers who have to go to work and using public transportation. We could see the direct connection between what was happening to people's health and the social determinants of health. And so we quickly rolled up our sleeves and started working with the leaders of those communities to see what could be done to mitigate the spread of the virus in those communities. And I'm proud of the work that we did. The rates of transmission in those communities is way, way down. But frankly, I wish we had responded sooner and had anticipated these trends. Responding at the moment is certainly part of the problem, or part of the answer, but an even better answer is working upstream and trying to prevent the problem from ever occurring. And so we're about to announce at both Mass General Hospital and across our health system, Mass General Brigham, a series of initiatives that we're deeply committed to that we think can help. One is that we're going to initiate a lot of work as what's called an anchor institution. We hire lots of people during the course of the year. We spend lots of money on supplies, and we also make major investments through our investment portfolio. And we want to try to get a twofer out of all of those things, use those resources to not only advance our business needs, but also to support the community by preferentially hiring people from certain communities, preferentially purchasing supplies from minority-owned and women-owned businesses, and also looking for opportunities to make investments in communities in the Boston area. So we think that's another very important thing that we can and should be doing. And last but not least, we are very interested in seeing a coalition sort of spring up across the city of hospitals, city government, the business community, working together to try to address the social determinants of health. There are other communities, frankly, in other parts of the United States, including West Chicago, that are significantly ahead of us in doing that. I think the whole community needs to come together, roll up its sleeves, and get to work on addressing such issues as housing, jobs, and within healthcare, the availability of mental health services. Those were the three things that were identified by the people of the city of Boston in the recent community health needs assessment. So Colette, those are just a few of the things that we are doing and are committed to doing in the very near future.
Thank you so much, Peter. And I'm so glad that you delineated some of those things that Mass General is doing in partnership with the Brighams. I think often people don't know how engaged and involved in the community and in health disparities that Mass General is. And I too came to the hospital not knowing your strong commitment to fighting health disparities, both in your Charlestown facility and also in your Revere facilities, primarily with Latino, Black and Brown people. So thank you for sharing that. And next to, I'm going to go to Senator Collins. Senator Collins, I am a firm believer that policy and public officials, elected officials, can play an important role in moving the needle when it comes to racial inequity, and in particular, economic inclusion and economic equity. I think there were many people who were shocked 5 years ago, and then 2 years ago when the Boston Globe did its piece on being Black in Boston and the disparity that the feds did on the wealth of a net worth of a Black family and a white family here, that the net worth of a white family was $247,000 compared to $8 for a Black family. As a policymaker, you have been doing some very interesting things in moving that needle. And I am wondering if you could share with us what are some of the best ways policymakers like yourself can help close the wealth gap and reverse this race to the bottom for Black and Brown people in our state and city.
Thank you for the question. It's an honor to be on this conversation with you, and an honor to be among the folks you have selected as panelists. I find that access, opportunity, and economic development is an incredibly powerful equalizer. And there are great resources here at the state and quasi-state level as it relates to entities, institutions that have large spending budgets to deliver their services, as well as their land portfolios. And we saw, as we were, in our early discussions in 2014, thinking about expanding the convention center and how you can, create broader economic impact for the community with accountability built in. So on the contracting side, as well as on the land disposition side, driving diverse equity teams. Because the land's everybody's, it's public land, so it's everybody's. And so that everyone should have an opportunity to benefit from the utilization, particularly when it comes to the marketplace. And we can be creative as well in using these tools because, they're entities that have a lot of advantages, like, exemptions from taxes, exemptions from local zoning. So that they come, equipped with a lot of tools to be good economic partners. And we have a piece of legislation on the goal line with the Economic Development Conference Committee that I believe both on the contracting side and on the land disposition side will have a great impact in driving down that gap, which, is essentially wealth creation and ensuring that takes place. But on a more local level, I'm hoping that it can be a real incubator for how the municipalities, and particularly Boston, looks at closing the housing gap, which I think is central to the wealth gap. If you think about what the, what the cost of an average home is in different parts of the city, I think the average cost is probably a little bit north of that, but that's it. That's home. That's equity in a home. I think the city can achieve that at a larger scale with folks that have been left out of home ownership space and therefore haven't had the opportunity to create generational wealth to the next generation. Because that in the form of real estate is where it takes place most. It's not like, they're giving checks away. It's usually, in the form of transfer of real estate. And, there's a lot of lots in the city of Boston, a lot of publicly owned lots, and they're in communities that are faced with gentrification right now. That's not a scary period for families, particularly with the eviction moratorium being lifted. And so I think as a next step, that'll be have as much impact, I believe, in closing the wealth gap, because it'll be closing the housing gap, the home ownership gap, and do it in a way where you bring equity to people in the communities they live, and give them a place that's their own to be able to, hand off to the next generation, which also includes a policy that we're really keen on with the city of, and the superintendent is very supportive of bringing sort of the trade revolution back to our high schools, where, you need to back that up with a good job too. Not everyone's going to be in the professional space, and there'll be a lot of that. But I think, we can't continue to lose out on the economic opportunities with building trades and other skilled trades where you can make 6 figures a year if you're working hard and working on overtime. So, there's a way to do that through our high schools, where other vocational schools have seen more success outside of the city of Boston. We're unique in that it's not its own school. It's not its own school district like the other vocational schools are. It's part of the city of Boston umbrella. And so they're not as, I don't think, as equipped. They're right now looking for new leadership. But it's really a direct partnership where they're giving kids time towards their trade while they're in school. So they're getting something for it, not getting trained, well skilled, and then getting to the back of a bench when they graduate. And then that period of 18 to 20 with a lot of disappointment is not really a plan for success. And so really at the city and state level, there's a lot we can do. I think a lot we're doing that needs to get completed, but I think we're on the right track.
Thank you, Senator. Steve Grossman, I am going to turn a question to you. And when you were the state treasurer, you did something that was quite revolutionary. And I firmly believe that what you did ties back to something that Peter Slavin mentioned. And, that is, how do you create a ripple effect so that you can get vendors, chain suppliers, the people who do business with corporate community and with the public sector, how do you hold them accountable for racial equity and economic inclusion and breaking down that closing the wealth gap and breaking down and dismantling racial inequity. You made a decision to not invest in businesses that did not have people of color and women on their boards. And I'm happy to say that your successor, Deb Goldberg, has continued that commitment. Tell us a little bit about what you are doing now in terms of your work with ICIC and helping large corporations across the country to support Black and Brown entrepreneurs.
Thanks, Colette, and thanks for the honor that you paid me and some of my colleagues 6 years ago, back in 2014. We hope we deserved it then, and we hope we continue to work toward those goals. Just a little clarification. When I was state treasurer, we actually did two things that I think bear directly on this issue. Number one, I was able to pass a resolution at the state pension fund, which is now a $75 billion pension fund, whereby if there were no women and no people of color on the boards of the companies in which we invested, we would vote against the management slate 100% of the time. If you didn't have diversity, we believed we should have zero tolerance for zero diversity. No women, no people of color. We would vote against the management slate and try to get other states to do exactly the same thing, to move the needle and to move the numbers significantly. Second thing I did was we took almost $400 million of state taxpayers' money, deposits that I controlled as treasurer, and we deposited that money into banks that were making efforts to loan the money to women-owned, minority-owned, and immigrant-owned small businesses, principally in the gateway cities and the city of Boston, of Massachusetts, in the belief that if you could put money in the middle of a recession back in 2011, 2012, in those small businesses, they would be able to grow, create jobs, and create a level playing field. I think when you said earlier and talked about dismantling systemic racism, you had it exactly right. Dismantling systemic racism throughout our society is essential to what you called equitable development and the advancement of people. And only if we're committed to that goal of dismantling systemic racism are we going to be able to reduce concentrated poverty and close the racial wealth gap. And we see systemic racism all around us. Access to capital. We saw what happened in the PPP program. When that program was announced and in 12 days, the first round of money was exhausted. If you didn't have a concierge relationship, a special relationship with a bank, you were shut out. And if you look at all the numbers and all the surveys, Black and Brown owned businesses were largely shut out for capital when 41% of the Black owned businesses in the United States were shut down between February and April. That is systemic racism, and that's going to change. In terms of discriminatory housing policy, it's not just that Black and Brown people are housing cost burdened. It's that we have discriminatory housing policy. We have 351 cities and towns, and we have rules on the books that basically require a 2/3 vote of the Board of Aldermen or the city council in a city or town in order to pass a change in housing policy, a zoning variance. I'm a Democrat, as you know, but a Republican governor, Charlie Baker, has been working for years now to try to pass a new policy to make it a simple majority. Imagine what it would mean in terms of opening up housing investment for people from diverse backgrounds if it was only a simple majority. That to me is another example of systemic racism. And the fact that in Nubian Square, in the Dudley Street area, 47% of the people who live there do not have internet access is also an example of systemic racism. If you work remotely and you don't have internet access, you can't work. If your kids are at home trying to learn remotely and you don't have internet access or a computer, and Marty Walsh has done a good job providing hotspots and computers, but if you don't have internet access, you can't learn. If you're trying to access telehealth services, mental and behavioral health services, Peter talked about that earlier, and you don't have internet access, how on earth do you access telehealth when you don't have internet access? And it goes on and on and on and on and on. And finally, you talked about corporations. ICIC works with major corporations, as Peter called them, anchor institutions. I salute Peter and Mass General Brigham for what they're doing. They're part of 26 companies that are part of a pace setters program at the Greater Boston Chamber of Commerce to try to beef up procurement from minority-owned companies. But it's not enough. It is not enough. Every anchor institution in Massachusetts, without exception, should make a commitment to publicly disclose the percentage of procurement they're doing with minority-owned businesses, Black and Brown-owned businesses, or as we call them, BIPOC-owned businesses, Black, Indigenous, and people of color-owned businesses. And hopefully that number will go up every year. There's a national organization called the $1 Billion Roundtable, 28 companies that buy $1 billion of goods and services annually from women-owned, minority-owned, LGBTQ-owned, and veteran-owned companies with an emphasis on Black and Brown-owned businesses. If we're ever going to overcome and dismantle systemic racism, if we're ever going to narrow that racial wealth gap, we've not only got to purchase more from those entities, but we've got to educate them, train them, mentor those companies, provide one-on-one coaching, get the capital in their hands, prepare them for capital, and make sure that banks, CDFIs, and other lenders and other financial institutions are prepared to put money in their hands. Because if you can get money, whether it's debt or equity capital, and you're a small business owner, you're going to grow faster, create good paying jobs, and create the kind of wealth that will help narrow and close that racial wealth gap. That's what ICIC, the Initiative for Competitive Intercity, is all about. That's what we spend our time doing. And we are proud to have partnered with Ingrid Beckles and Peter's colleagues over in Somerville who do that procurement to help make that possible. So thanks very much for the question, and look forward to the rest of the discussion, Colette.
Thank you, Steve, very much. If I could add something to that wonderful and very well thought out list. As a small woman, minority-owned business myself, I have to say that one of the things, and Peter made reference to this in the beginning, that I think big companies can do is in terms of their supply chains. For example, a lot of these businesses put small business and minority-owned businesses through what I call these onerous vetting process that they don't require of the larger white companies. And I think what companies can do is to ensure that if they're buying big products from, they're doing accounting, they're doing legal service, advertising, public relations and marketing, and a number of other goods and services that they are purchasing, they should expect and demand that the companies they're doing business with also basically reflect their values and their commitment to racial equity, and insist that these companies spend dollars with minority-owned companies, with BIPOC companies. So I think that you are spot on, Steve, and I think that this can be done. It's not rocket science. It takes deliberate intentionality, thoughtfulness, and commitment. And I'm going to ask our professor, who has been at the epicenter of all kinds of great research that's been done by Boston Foundation for their indicators report. Everything from research around affordable housing, to immigration advancement, to life sciences and job opportunities in Massachusetts. And now that he's retired, he's the busiest retiree I know. And I want to hear from you, Professor. What are some of the things you are doing? I think Nick made mention of some of the work that can be done for young Black and Brown and Indigenous youth. And I'd love to hear you talk about what you're doing with Madison Park and Housing Forward in a way to begin to dismantle systemic racism?
Well, thank you, Colette. It's a real honor to be here. And it's one of the few times I'm actually proud of being a white guy with these other wonderful folks on this panel. In my quote unquote retirement, as you put it, I have been deeply involved in both the Madison Park Technical Vocational High School, the one vocational technical high school in the city of Boston, and with a brand new organization headed by our friend Josh Zachem called Housing Forward Massachusetts, trying to deal with both of the issues that Senator Collins just raised with us. I became involved with Madison Park about a year ago. I'd like to take us back to my beginnings in Detroit when I was deeply involved in civil rights activity, but we were trying to get the right to vote in Montgomery, Alabama. We were trying to integrate a swimming pool outside of Detroit. We were sitting in at lunch counters. Today, those are still very important, but the important thing is finding the resources and the opportunities for people in the Black and Brown community that have been denied because of racism and systematic racism for generations, for centuries. At Madison Park, we've created the Madison Park Technical Foundation and the Madison Park Career Champions Network, which includes today about 40 leading civic leaders and business leaders. And that organization is committed to making Madison Park one of the best vocational schools, not only in Massachusetts, but in the country. And it's had a checkered past. It's been a difficult school in the past, but under Kevin McCaskill, its new executive director, it's making real progress. The Career Champions Network is working on getting co-op opportunities for more and more of our students. It's working on trying to provide good business opportunities for all our kids and link each of our 20 workshops to business leaders who can help develop those programs. And then the foundation, which was created, and I'm proud to say that our former Governor Deval Patrick has agreed to be the honorary chair of the Madison Park Foundation. I'm very proud to be the president, along with others. Colette, you're a vice president of that organization. We're going to be raising a large amount of money to increase staffing at Madison Park beyond the BPS budget, provide more opportunities for the students to get career counseling, provide them with more opportunities for good jobs. We're also talking about developing an adult education program at Madison Park so that more adults could take advantage of that school after hours and on weekends. And we're working with my friend Ed Jordan, a fellow who spent 19 years in prison, came out, became a welder, now has his own company, Black-owned company of over 50 employees. And we want to find ways of getting even more adults the kind of education and skills they need to move into those $50,000, $60,000, $100,000 jobs. On Housing Forward Mass, we just formed this organization, and the whole idea is to deal with the whole question of affordable housing and opening up housing opportunities for people across the whole Commonwealth. One of the things we'll be working hard on, indeed, is Baker's Housing Opportunity Bill to reduce the 2/3 majority you need in order to change zoning. If we can deal with housing affordability and housing opportunity, if we can give our young people, particularly those who are Black and Brown, the kinds of resources and opportunities that allow them to begin to close the income gap, close the wealth gap, which is so massive, I will feel that in my retirement, I've continued to do the kind of work as an ally, as an accomplice to making the kinds of changes with the other people here. And I must say, with an increasing number of business leaders, I'm proud to say that more and more seem to be people waking up and understanding there are things that each one of us can do in our own little ways to provide the opportunities and resources for everyone. Thank you again for letting me join you today.
And thank you for what you're doing in the communities of color and BIPOC communities to really help our young people, because they're the future. And I truly appreciate that. Sean, last but not least, my question to you is that you're in a unique position where you advise and counsel. You run an advisory consulting firm, and you work with a number of CEOs, many of whom are white. And you also, I think, have the opportunity as a white guy to really support organizations like the BAA, the Boston Arts Academy, Dorchester, College Bound, and just a number of organizations, most of whom work with BIPOC young people. And I would like to know from you, how can white males begin to use both corporate philanthropy and philanthropy in general to begin to chip away at the philanthropic disparities? And how can they partner with organizations like the Madison Park, like the Get Connected Fund that is newly launched to really support BIPOC businesses, and the new Commonwealth Fund for Racial Equity and Justice? Your volume.
You hear me now? Sorry.
Yes, we can hear you now, like the Verizon commercial.
Yeah. So I think two things. One is, I think there needs to be a reposturing from a posture of leadership to a posture of service for white leadership in the city. And the reason I say that is because Boston is not lacking for Black and brown talent and leadership. We have it in huge numbers. The question about whether it is seen by kind of establishment companies and corporations and institutions is really a big question for me. My answer would be, no, it isn't seen. Now I see it because I try to be involved in these types of things, but I try to be involved in those things from a posture of service, as opposed to a posture of leadership, because the leadership that I follow tends to be folks who are leading these organizations happen to be Black, happen to be Latino or Latinx. So that's one thing, changing the posture. We don't need to lead all of this. We need to follow some of the leaders that exist in the community. The second thing is we need to find the holes kind of in our civic fabric and fill those holes. And I'll give you one glaring hole in particular. Lenox Street is a housing development on the outskirts of the South End in Roxbury, kind of on the outskirts of both neighborhoods as we see those neighborhoods. And as the South End is gentrified over the years and Nubian Square has kind of gotten a lot of focus, this part of the city has been basically forgotten. And as foundations shift their focus to address kind of systemic disparities and new groups form with the express purposes of engaging this population and developing community assets, the historic disconnection from places like Lenox Street should be the focus for all of us. You know, we also have to get have to get people out of this mindset of charity and philanthropy not being a social investment. We've got to get people to think about community building and social investment and to get away from this idea of that's a good cause. That's a good cause means we give a little money. A social investment means we've got a stake in this and we want to see it succeed. And so I would look at Lenox Street as an example where there's this glaring hole. I'd look at something like Boston Arts Academy differently. It's a matter of whether we as a community look at the students who are artistically talented, who are Boston public school children, and say they don't deserve anything but, you know, the lowest possible quality of arts education. That's not what we say as a community. What we say is they deserve the top quality of arts education, something that, you know, somebody might pay a private arts high school $51,000 to $60,000 a year. We want our kids to have exactly the same quality. And that is a choice, but it's a choice for a whole community. And I think if we are reposturing ourselves into this posture of service, I think if we are following leadership and directing our energies where Black and brown leadership tells us we need to be focused, I think we'll be in much better shape.
Thank you, Sean. And I'm going to throw this question out to our panel. What and when was your eureka moment that caused you to really be spurred or inspired to really become an advocate, an ally, and in many cases, the work that each of you are doing, an accomplice to racial equity? And I'm just throwing that out to any of you can take that question.
Paulette, this is Peter. I'd be happy to comment on that.
Absolutely.
I think you've heard this story. My great-grandfather immigrated from Lithuania over 100 years ago, settled here in the Boston area, and had an accident and received care at Mass General Hospital over a 10-year period of time. Got all that care for free. But I realized that if his daughter, who used to take him to the hospital those days, my grandmother, had wanted to train at Mass General back in the 1920s, that wouldn't have been possible because Mass General, the Brigham, and many other hospitals around this country wouldn't train Jewish physicians. And so I guess realizing that when I arrived at Mass General and encountered a place where it was still a little bit uncomfortable to express the fact that you were Jewish openly, it made me realize that we had a responsibility to make it easier for other people to break into the culture of the organization and feel as welcome as everyone else. So I guess it was my family history and that realization that remains the fire in my belly that makes me pursue this work every day. On top of that, I realized not only is it the right thing to do, but for Mass General Hospital, it's from our business standpoint, if we don't do it, it's putting our organization at peril in the future. So that's where I first got interested in this.
Thank you, Peter.
Colette, this is Steve. You know, having been chairman of the Massachusetts and National Democratic parties, where racial equity is a key ingredient in both of those, this has been part of my life for a long time. But I think it's important that everybody understands that allyship is a process. Everybody's at a different place or stage. The challenge is to go from intention, because you can sit in intention for a long time before you get to impact. And we need examples of what strong allyships look like, where there's real power in sharing, and where there's real power sharing, I should say. To me, it's all about using my power. And what I've learned in the last few months is a lot about what white privilege means and how do you use your power and your privilege to support others in the BIPOC community and partner with them. Take a back seat, give up your seat to make sure that others are sitting at the table. Lead from behind, which is a phrase that's used quite often these days. There's a wonderful book that I shared with your colleague Ariel, I hope she'll put it up on the screen, called Beyond Ally, The Pursuit of Racial Justice by Dr. Maisa Akbar, AKBAR. And she talks about the various stages of allyship. But you know, your own organization, you've got to walk the walk, you can't just talk. So we've diversified our board, we've diversified our senior staff, we brought on a DEI consultant, a wonderful consultant named Marcela Aldaz. We've posted our DEI commitments on our website. We've been training our colleagues in best interviewing practices, eliminating race, ethnicity, even gender from the interviewing process so that we consider people as individuals and not in the context of race and ethnicity. And creating an environment where even remotely we can celebrate diverse traditions and make people feel comfortable in their own environment and comfortable that they're being celebrated and empowered. So to me, it's about partnering with organizations like Amplify Latinx and BECMA and others to really begin to share power in ways that give people the leadership roles that, as Sean said quite rightly, there's plenty of Black and brown leadership in this city. We just have to make sure that we use whatever clout we have to give them maximum opportunities, because they are ready to serve, and we're seeing it all around us every single day.
Thank you, Steve. I'm going to respond to someone in the chat who said, who are the brown people? Because this person thought that brown people, the term is offensive. And to me, I do not see it. I see it as inclusive. Brown people are people who are from South Asia, people who are from South America, who are, Latinx. And when I like the term Black instead of African American, because Black is more inclusive, because not every Black person in America or in Boston is an African American. I am from the Caribbean, I'm an immigrant, so I cannot take on the mantle of being an African American because I wasn't born here, but I am a Black American or I am a Caribbean American. So I wanted to respond to that person about the term, Black and brown. This is a term that we are using to be inclusive, not exclusive. So I just wanted to make that point. I'm going to throw out another question here about, I believe that it takes courage. Some people might say, no, it doesn't. I believe it takes courage to be inclusive and to speak up and move from allyship, as you said, Steve, into accomplishship, which is really taking action. An ally to me, is someone who supports anti-racist work, but an accomplice is someone who actually does the work and supports it and partners with communities that are the victims, if you want to say that, of racism and bigotry. So I'm going to ask you, and this is a question I'm throwing out, how did your courage to be inclusive develop, and did you have a role model for courage in your own life?
I'm willing to take a crack at that.
Okay.
I'm probably the most fortunate person on this panel. I grew up in a wonderful family in Detroit, Michigan. My father ended up being a vice president of the Auto Workers Union. He was administrative assistant to Walter Reuther, one of my true heroes, a dear friend of Martin Luther King's. I still remember going to a Christmas dinner at Walter and May's house. Walter and May Reuther and Martin Luther King and Coretta King were his guests that I was 12 years old. So I grew up in a family that was committed to racial justice from the very beginning, and a union at the time that was committed to racial justice. Walter Reuther was one of the 10 founders of the March on Washington. So I've been very fortunate to grow up there. I was also very fortunate to grow up in Detroit in a school system that was fully integrated, so that half of my friends were people of color, particularly my black friends. But I think the difference in courage is, I remember what courage took. That was going down to Montgomery, Alabama in 1965 with John Lewis, and having to go up against George Wallace's mounted henchmen with their truncheons going after people's heads, including mine. Today, I don't want to scare people off and say this takes courage. This just takes commitment to be an accomplice. We have a movement going on now that I hope will continue, and I expect it to continue, particularly I hope after a victory on November 3rd, to really spend a good part of our lives, particularly I'm talking about us white folks, committed to racial justice, committed to economic justice, and that we may have now a point in time which we haven't seen since the 1960s civil rights movement, but one that's now really focused, as I said, on the whole question of opportunity and inclusion. And to me, what we need to do, and what you're doing so wonderfully, Colette, and all of the panelists, is trying to get as many people doing the same thing that you are lauding and that you do in your life every day. Because the more of us who sign on to that great, that great thing about being an accomplice, the faster we're going to make the progress we need.
I'd love to.
Hello, if I could chime in, I have a, sorry.
Okay, Senator, or
Okay, someone else jumped ahead of me, so I don't want to.
Dawn, did you want to?
Want to go? You go first, Senator. Go ahead.
Okay, sure, thank you. No, I think he's absolutely right. And I think Steve brought up a great point about power sharing. That's critical. And power sharing comes in different ways. It comes with elected seats and elected representation. It comes with board representation. It comes with executive leadership. I think one of the things that the legislation we had worked on, beginning with the convention center, I want to give due credit to former Senator Linda Fori. Well, I guess I would assign my inspiration for courage is she was a big part of the leadership on this. And what I think made it most impactful, what tends to make policy happen and being most impactful is when it's backed up by data, whether it's identifying those disparities and showing how those impacts can be shifted with a policy. I think the data is usually very clear on this whenever it's being discussed, whether we're talking about, exam schools or economic wealth gap. That really is what needs to be guided, because that's, it's objective. And so I think some of the folks that are watching have chimed in on the chat and saying, how can we, move forward with all this unrest, and the middle ground seems to be a position that not many are willing to take, or it's too hot. But I think the data is apolitical, and that is usually what's the guidepost, and all these issues that we're talking about around equity is at the heart of it all. Otherwise, the argument wouldn't last long, and it does, and we're not finished with it because we haven't necessarily hit the sweet spot on all these areas of policy that we're discussing today. But I think the data is what really kind of motivated me, because it's linked to health disparities, and it's linked to other disparities. So they're all interconnected, and in terms of people's quality of life, the people that I represent, my job is to try to lift that standard, and this is a big way to try to do that. So I'd say on the inspiration, definitely Linda Authority, and as it relates to what can, on the courage piece, and what should guide us in kind of our own inspiration, it's the data. It stares at us in the face that you can't argue with. So
Thank you, Senator. I love the fact that your role model was a Black woman.
So in terms of role model, Colette, you know this story, but the person that was held up as an example by my father from the age of 6 was Winston Langley, who was a political science professor for my father in college, went on to become the academic dean at UMass Boston. And Professor Langley or Dean Langley would be embarrassed to hear anybody talk about that. But he was held up as the example of human excellence in my life. And classic Boston Irish guy. My father never told him until I pulled the two of them together for lunch about 5 years ago, so that my father could tell him that he felt that way about him. But in terms of courage, I think the courage that is required right now is courage to do something that's pretty uncomfortable for a lot of us. And that's, we need to pull the still waking out of their slumber. Because the perpetuation of this particular system of inequality, of inequity, feeds on indifference. I went to the mayor's first dialogue on race held at the Emerson Theater a couple of years ago. And as a remark to Michael Curry when he was at the back of the room, he and I spoke after the event, said, the problem isn't with the people that are inside this theater. The problem was everyone sitting at home that Saturday that couldn't muster enough interest to show up. And shaking a lot of our peers out of that slumber is the uncomfortable thing to do. I'm not suggesting for a second that it requires any courage. It feels like a human responsibility, frankly. But trying to get past that indifference is important. you know, we have all got a hand in perpetuating systemic racism, every single guy on this panel. And the thing that we're having to work towards is moving us off of that dime and into a completely different place. James Baldwin said two things famously that I want to share. He said, "Not everything that is faced can be changed, but nothing can be changed until it is faced." And he also said, "People are trapped in history, and history is trapped in them." And we've got to look at ourselves and accept that we have responsibility, identify those structures that we have perpetuated, and offer ourselves in service to change those things. There's real hope with Gen X and the millennial generations because less history is trapped in us. There are plenty of boomers that I see as very enlightened, but so many benignly internalized kind of the racial balkanization that has plagued us. And we have a tortured history in Boston along those lines. And some of that is generational. I think it's going to start to correct itself a little bit because that history is not in us. And I can shout out one of our fellow panelists. You know, Senator Collins is the senator from South Boston, but he represents one of the most diverse districts in the entire Commonwealth. And in his role as a state senator, he acts as a convener of a lot of different conversations. It could be bike advocacy, it could be anything. And reflexively, he centers Black voices in those conversations. I see it. Reflexively, he calls upon people who are resources to him to support Black candidates for public office, like a Brandy Fluker Oakley. I would not know Brandy Fluker Oakley. I would not have raised money for Brandy Fluker Oakley if I hadn't been asked by Senator Collins to do it. And it's because of those things that I think we've got a little bit of hope to feel about the current situation we find ourselves in, because I think we're headed in the right direction, but it's gonna require us feeling uncomfortable about pulling a lot of people out of that slumber.
Thanks, Sean. I'm gonna open it up now, and I have a question that came in for Peter. Peter, there was a question from one of our members of our audience that says, with the movement to value-based care and the advent of accountable care organizations to improve care delivery, including cost and quality of care, how should such models address racial health disparities?
Well, Colette, I don't think there's any payment system that in and of itself can eliminate structural racism from healthcare. But I do think that these newer payment systems that include accountable care organizations are much better environments to address these issues than the older fee-for-service system. In fee-for-service, there are major incentives to focus on people who have well-paying insurance and avoid people who don't. Whereas in an accountable care organization, assuming the population is drawn from a population at large, those incentives go away. In addition, in an accountable care organization where you're at risk financially as a provider for the cost of care of the population over the course of the year, you have a much greater interest, or financial interest at least, in keeping people out of the hospital, keeping them well. And I think doing those things will directionally make you focus on the social determinants of health, and which can only benefit minority, poorer populations.
Let me just add one quick comment. Look, Peter knows, and we all know, that poverty, concentrated poverty, creates terrible disparities in life expectancy. Life expectancy in Nubian Square is 15 to 20 years less than it is on Beacon Hill.
33
Well, depending upon the way you look at it, it's many, many years. So if we are going to deal with concentrated poverty, and if we are going to create real wealth in these under-resourced communities, it's going to be the small business community and a sustainable small business community that makes that happen. If that happens, we'll have fewer food deserts, lower levels of diabetes, lower levels of low birth weight babies, hypertension, cardiac disease, and there will be a coming together of the community around dismantling systemic racism and dealing with concentrated poverty. So small businesses to me and getting access to capital, which is why I'm hoping in a new administration, hopefully we have that next January 20th, we can really revolutionize the way the Small Business Administration treats Black and brown businesses in the lending process.
Thank you, Steve. I want to give a shout out to a pioneer and an icon in the medical community who is on this call, Dr. Gus White, who is in his 80s and a prolific writer. He is the author of 2 books on health disparities. And I want to say that Dr. White, thank you for being on this call. He was one of the first chairman of a department at a hospital and an outstanding orthopedic surgeon at the BI. And I am so delighted to have him on this call. Somebody was going to say something.
Oh, yes, Nick Collins. Thank you, Colette. And I want to thank the President Slavin for his remarks. One of the things that I saw play out during COVID-19 that I thought was incredibly powerful with both the healthcare community and policymakers on Beacon Hill, again, using data on the bias from the crisis standards of care that were initially put out, as we were looking at potential limitations to resources, ventilation, equipment, ventilators, and they, were wrestling with those decisions. When we took a step back as both the legislature and the executive branch in partnership with the medical community, moving away from those, we saw that when there was less bias in our system of care delivery, we saw more resiliency from the community in their recovery. Though we saw that they, in my district, communities like Dorchester, Mattapan, Hyde Park had higher rates of contractions. They had also had higher rates of survival when access to that care was equitable. And so just kudos to President Slavin and the medical community for making that adjustment with us at the state level. And just to thank Sean Curran too, who as a business leader has made it easier for me to do that kind of, as he led the way with the Patrick administration thereafter. So just kudos to Sean and President Slavin. But I did want to just make point of that as it relates to the healthcare community and how we can, make adjustments to getting better care. It's just dropping down those barriers. We did it in 2006 with making healthcare universally accessible for all. And, we still see, implicit bias in the system that needs to get changed. And when we get zeroing out like we were this year with COVID-19, I think we made, smart adjustments that were more equitable. And I think showed that the community who I think the system had doubted, was resilient to that care. And my hope is at the end of it that we're driving down the trust gap, because the trust gap on institutions in general, particularly healthcare institutions, is still significant. We have universal healthcare since 2006, still over 200,000 people in the Commonwealth without healthcare insurance. So, that's 25,000 plus in the city. And as Steve pointed out, in the city of Boston, no offense, but not the Berkshires, we have internet service gaps, and that's just, unacceptable. So we did put some funding into a capital bond bill, IT bond bill on that to close that gap in the city of Boston, at least, along with putting resources together, as he pointed out, the need on those IT resources through the Mass Growth Capital Corporation for small business grants to businesses that have had higher impacts from COVID-19. But on the healthcare piece, I think we can continue to make progress, making better policy decisions on how we bring access to people, equitable access.
So thank you, Senator. And in closing out, I am going to ask each of you, because I believe in the power of mentorship, and I believe each of you have an important role to play. So I'm going to ask you to tell me one thing that each of you will do to mentor another young white guy who will become an ally and an accomplice to changing this space. It could be a son, it could be a daughter, it could be a son-in-law, but I'm going to throw it out there and each of you can tell me. I know who Peter is mentoring, so but that's because I'm close to some of what he's doing. So I know a couple of his mentees, more than one, but I'm going to throw that out to each of you.
Sure. Well, I think that is a really important point because, leading by example is how I've learned from others, from their example. And I think that's most important. So, as we annually have interns that come into our office, we have a summer internship program. Sometimes it bleeds into the winter as well. But, part of the experience is to get into the policy and why we're behind certain policies. And the same with staff that work for me. And then, you don't work in the legislature forever, so there's a little bit of turnover. So it does bring opportunity for people to come through, and we've worked a lot with the staff to move the legislature in a direction to bring more diversity to the ranks in the legislature. I think is really important, both in the staff level, obviously in representation. But I think for the young white people that come into my office, young men and women that work there, I think they see that and they know that that's what we're about. And again, backed by the data, and that's, I think, what can get you through any turbulent debate is when the data's on your side, and we're gonna have plenty of them. So I think using my office that way is the best.
Thank you so much. And maybe people don't know that he had a young Black woman as his chief of staff. So not only does he have a Black role model for courage, he also had a Black chief of staff in his office. So I applaud you for that.
Very
and
lucky
I
for that.
also thank you for the monies that you have helped to steer to BECMA and to the NAACP's event, and also your latest legislator on public funds and public property and land to be inclusive of people of color. So thank you very much for your work. Anyone else who wants to share with us what they're doing or going to do to mentor others? Because we need more white men who can jump. So, Sean.
I kind of am in the position of having a formal mentorship role because I've got 3 sons, all of whom have enjoyed a pretty privileged upbringing, but are in institutions, whether it's high school or college with my oldest, that are very multiracial environments. I don't have to get them where they need to be in terms of their heart. I don't need to get them to where they need to be in terms of the sentiments that they have about the issues that surround issues of racial equity. What I've got to get them to be is bold. What I've got to get them to be is upstanders in the face of people not taking a bold stand. That's what I've got to get them to be. If there's ever a focus for young people, it's that peer pressure that would suggest to them better to keep quiet and not cause any trouble. That there are moments when trouble, good trouble, necessary trouble, as John Lewis would say, needs to be caused. And I want to encourage my sons to do exactly that.
I want to thank you, Sean, for that. I feel the same way about my 29-year-old son, Josh, who after college decided to teach in the inner city of Chicago. He'd gone to Northwestern and then spent several years teaching here in Boston's Center City. But I think the idea of having our next generation be bold is so important. In terms of my own mentorship, I'm doing my best with my colleagues to recruit as many folks, diverse folks and younger folks to this Career Champions Network, working with Madison Park, because we think will provide so many opportunities for both high school kids and increasingly adults. And I'm finding it's a very, very good way to get people introduced personally to the struggle for increased opportunity and racial justice. If I could add, Steve brought up one really fine book. For our audience here, I'd like to suggest another if you haven't read it. It's Caste by Isabel Wilkerson. And I have not found a better book that explains white privilege and explains the caste system that goes back to the first, folks who came here to invade America back in the 17th century. It's just a brilliant book. It's won every kind of award, but I've read a lot of books. I've never been touched or had such great impact as this book, Caste by Isabel Wilkerson.
Thank you.
I'll second that. I'll second that motion that it is a must-read book. And I was just going to say, Colette, that I'm very active. I get a lot of calls from a lot of people who want to run for public office and they want advice how to run for office. They're not only white, they're people of color, they're men, they're women, but a lot of them are white men. And I am constantly sharing with them the importance of standing for something that means something. If you're not prepared to stand up and speak out when people act in ways that demonstrate racial injustice, or people who are simply insensitive and they make remarks, you've got to be willing to speak out. It's uncomfortable to do that, but you've got to be willing to do that, because if you stand by, you become complicit in maintaining systemic racism.
And I would throw in one other thing. My office is one of those offices that before COVID, a lot of folks who were thinking about running for public office would come, mostly candidates of color. And I think it's probably because I chaired Governor Patrick's campaign and was his finance chair for a number of years. And so they've got to know me during that period of time. And I will tell you that the future could not be brighter, because even those who choose not to run for public office for any number of reasons, I find that as I track them, they're in big jobs, they're in important jobs, and they're doing important and big things. And so that fire that gets them into the office to talk to somebody about potentially running for office, even if they don't decide to do that, they're still folks who are dedicated civically. They're folks that have enormous talent, and the future, from my perspective, is bright.
Thank you, Sean. And Steve, thank you for having your office in the heart of Dudley, in the Black community, and for being responsible for the first Black chair of the National Democratic Committee, the late Ron Brown. A lot of people don't know that, but you were very instrumental in making that happen 30 years ago. Peter?
Thanks, Colette. As I mentioned earlier, we're about to roll out what I think is a pretty bold and comprehensive program aimed at structural racism within our organization. It's going to focus on the organization itself, as well as our patient care and relations with the community. And I suspect I'm going to be mentoring a lot of white men along the way to help make sure that that program is as successful as I want it to be.
And thank you for all the people you have mentored of all cultural backgrounds. I appreciate everything that you have done, and your bicentennial scholars that you put in place to encourage more young people of color to get into the medical and healthcare profession. So thank you, Peter, for all that you do, and for being a white guy who can jump, even if you're a doctor. And thank you. I want to thank everyone who participated both on this panel. Thank you for your insights, for your wisdom, for the work that you all do and continue to do, and the difference you're making in your respective fields and in the contribution you're making to our community. And I want to thank you for that, and keep jumping. We need you. Take care. Okay.
Thanks, Colette.
Thank you. All righty.
Bye, Colette. Thank you.
Thank you, Peter.
Bye,
Thanks,
Colette. Thank
Senator.
you.
Thanks, Steve. Thanks, Barry.
Thank you, Colette.
All righty.
Be well, everyone.